We've all heard of BMI, body mass index, but have you heard of the Edmonton obesity staging system? Probably not, unless you are in the field of obesity medicine. But I'm going to tell you what that staging system is, how it's classified, and how it can be helpful in helping to guide treatment for the disease of obesity. My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician. And I have a telehealth practice called Missouri Metabolic Health, where I help adult patients all throughout the state of Missouri achieve and maintain health by focusing on lifestyle optimization and weight management. And I use safe and effective medications to help achieve those goals. So the reason that BMI has been used so often to classify and define obesity is because it is easy, cheap, and reproducible. It is a calculation that takes into account somebody's height versus their weight. All you need to do is measure their height and weigh on a scale and plug those numbers into a calculator and you have the BMI. Really doesn't take any money to do, and we can watch that BMI over time and see if things are going to higher numbers or to lower numbers. And so there are benefits to BMI for those reasons, but there are a lot of drawbacks to the BMI. And it has gotten a lot of criticism, appropriately so, because of these drawbacks. Namely, it does not tell us anything about body composition. So we're only looking at total body weight. We have no idea if that body weight is mostly fat mass or if it's lean mass with muscle and bone. Water weight is another highly variable component that we cannot distinguish with BMI alone. So, as with anything in life, there are good and bad things that come with the BMI. And it can be a helpful indicator and something that we can watch over time, but we just need to take into account those limitations. The field of obesity medicine is rapidly evolving with our new treatment options, our GLP-1 agonists, and similar medications. And along with that, we are clarifying the definition of obesity. Since 2013, obesity has been recognized by the American Medical Association as a chronic condition. In medicine, this hasn't been very long of a time. There have been new definitions that are put out there that are taking into account more specifically body composition compared to just overall weight, which I think is a great direction for the medical community to be going into, because it's that excess weight, specifically excess weight in the abdominal region and within and around our organs, that negatively affects our health. We want to identify people, no matter what their BMI is, with the excess fat cells in those areas and treat them accordingly, so then we can help lower their risk of weight-related complications like cardiovascular disease, diabetes, fatty liver disease, chronic kidney disease, high blood pressure, abnormal cholesterol, obstructive sleep apnea, and several cancers. There are people who have a normal BMI or maybe are in the overweight category that are less healthy than people who meet the BMI criteria for obesity. And there are people who meet BMI criteria for obesity that are extremely healthy and have no chronic conditions and are able to do everything that they want to do in their lives. Should we treat the person with a BMI in the obese category and not treat the person with a BMI in a healthy or overweight category but has metabolic related conditions? Which one deserves treatment? We need to identify who is healthy, who is metabolically healthy, and who is metabolically sick, and help the ones who are metabolically sick or unhealthy. And that is what these new definitions of obesity are helping us do. But before we even had these new criteria, we had the Edmonton staging system of obesity that gives us different stages, kind of like how we stage cancers, and we are able to stage the condition of obesity. There are 5 stages, and I'll go through each of them here. So stage 0 is where we all start. We have no conditions that are related to our weight. So even if we meet BMI criteria for obesity, if we have no weight-related conditions, then our Edmonton staging score is 0, which means we are healthy and we do not need to treat our weight for a health-related reason. Next is stage 1, which includes subclinical risk factors. So this is like a pre-disease. So your blood pressure may be getting a little bit higher. You may have a little bit of joint pain. You may have pre-diabetes. Your cholesterol numbers may be a little bit abnormal, but you are not requiring treatment. You don't need a medication. You're able to function very well in your day-to-day life. This is when the utilization of lifestyle treatments, diet, exercise, stress management, sleep hygiene are so effective. They are able to catch the early diagnosis of these diseases and help prevent the progression to the full development of these conditions and help bring that person back to a stage 0. Lifestyle is helpful for everybody. Lifestyle modification and optimization is helpful for all of us, no matter what stage we're in. But this stage 1 is where it is so powerful because it will truly prevent the development of disease, and it'll stop it in its tracks and bring that person back to their stage 0, their healthy state. Stage 2. Now somebody with obesity has developed a weight-related condition. They now have type 2 diabetes or hypertension, high blood pressure, that requires a medication. They may have obstructive sleep apnea, acid reflux, GERD, osteoarthritis, the wear and tear on the bones that requires treatment. This stage is another really important one to identify because if we recognize that these conditions that have developed are related to the weight, and we treat that underlying cause, the weight, the metabolic dysfunction, then we are able to treat all of those conditions by treating the excess weight and the metabolic dysfunction, rather than adding individual treatments for each of these that develop. It's important to address each of these conditions, and it may require temporary medications like blood pressure or cholesterol medicine or anti-inflammatory medications or heartburn medicines while we treat the excess weight with possibly Wegovy or Zepbound. And once we are able to treat the underlying condition, the excess weight, the obesity, then we are highly likely able to reduce or discontinue those other medications. Stage 3 is when those weight-related conditions have either been going on long enough or have become severe enough that they are themselves beginning to have complications. So this is when heart attacks happen, strokes occur, there's complications from the diabetes, chronic kidney disease, skin infections, ulcers, neuropathy, decreased vision. This is when it becomes imperative to both treat the obesity as the underlying cause, but also get a hold of those chronic conditions and address the acute complications as they arise. Stage 4 is unfortunately when we have end organ damage. So this is when we need knee replacements for osteoarthritis. Maybe somebody is confined to a wheelchair or a bed because their weight has affected their motility. End-stage kidney disease requiring dialysis. Heart failure. The fatty liver disease has progressed to cirrhosis. These are very sick patients who were not caught at those earlier stages, were not treated for their underlying condition of obesity, their complications of high blood pressure, osteoarthritis, diabetes, dyslipidemia, have them in themselves developed complications, the cirrhosis, stroke, heart failure, heart attacks, kidney disease. This is when it is impossible to reverse these conditions. And what we're left to do with is manage these chronic conditions. This is why I went into the field of obesity medicine. We as a society need to realize that it is safe and effective and necessary to treat the underlying cause of these now common conditions. If we do so, we are able to keep people healthy long term and prevent these catastrophic conditions that develop as a consequence down the line from excess weight and metabolic dysfunction. The field of obesity is not about everybody reaching a normal BMI or normal weight, a certain pant size. It is about achieving health and improving people's lives, improving longevity, as well as functionality in their lives. Nobody wants to be sick at the end of their lives. We want to feel well and fulfilled and have lots of energy and play with our kids and our grandchildren. By treating the disease of obesity, we are able to accomplish that. We have health-related goals that we are able to achieve with appropriate treatment. If you or someone you love is struggling with metabolic dysfunction, excess weight, and obesity, I highly recommend that you find an obesity certified physician in your area, and I will provide some links below to search for them. And if you live in Missouri, I can be your doctor no matter where in Missouri you live. Missouri Metabolic Health is my clinic. Check out the website and I'd be happy to see you. Please let me know what questions you have. I would love to address them further in a future video. Everybody have a safe and healthy week, and I'll talk to you next Monday.